I first got diagnosed with depression when I was 7, so I grew up living with depression. My main treatment was just to be moved from medication to medication. When I moved away to uni, I decided to stop all medications and very quickly declined. So I was back on medication again. I had another diagnosis change, so the first one was depression, then manic depression, bipolar. My time at uni was spent a lot of severe self-harming, a lot of taking myself to rivers and having to be found by friends. To then come back from uni and just hit rock bottom. It almost was just as if like, well, you ain't gonna get better, so, you know, who cares what goes on. I'd definitely hit rock bottom before I started my SCM. I got my diagnosis whilst being in a psychiatric hospital. I went into the appointment and the psychiatrist said, I don't agree with your diagnosis, so we're going to keep you in longer to change it. We think you have emotional stable personality disorder. And I flipped and stormed out the room. So it never really got explained to myself or my family what the diagnosis meant. But I had to physically go out of my way to find a member of staff who would sit down with me and explain what the diagnosis meant, what it meant for my future, what it meant, you know, why did this make sense, why did that link in. I sort of found it difficult with it not being a well-known diagnosis. It's not as if, you know, schizophrenia, everybody has heard of it, which made that a lot more difficult with trying to have it explained. But then also in a way I was just like, what's another diagnosis? When you've had, you know, as many as I have, what difference does that one make? So when I first got told about SCM, I sort of viewed it as well, I've had CBT, I've had DBT, I've had counselling, I've had this, that, the other. What difference is another course going to do? And I found when I went home and Googled it, there wasn't a lot on there either. And then when I asked more with my CPN, they're like, well, it's something new, which is why there isn't a lot of information about it. For me, it was a fear of, will this help my mental health, or will this hinder it, and do I dare risk it? When I was told it was a group session, that was when the first bit of panic kicked in. We very quickly, as a group, became a lot less worried and a lot less stressed about turning up to group. Going into it with an open mind was definitely a lot more helpful. And I think with the groups as well, when you get to know your group, I found they were really good at being like, actually, Kerry, this does relate to you. It was definitely easier for somebody who was impartial to your situation to be able to go, no, look, this is what you are doing and this is what you aren't doing. One of the things that was carried on through all the modules was the escalator, which to me originally, I thought I went from 0 to 100. There was nothing in between for me on the escalator. You start to understand it a bit more, and that especially in one-to-one, you can go through, you know, however many things had happened during the week and do that with your one-to-one. I think one of the main things I did with my one-to-one was trying to understand why my admissions had happened. My one-to-one was really good at being able to be like, right, well, let's try and put this into your situation, into your everyday life. When we came to the end of the sessions, I'd just been given keys to my own property for the first time, and I found the stress of moving out and suddenly having to look after myself the whole time had got too much for me. And at one point I ended up having to be put back under with a crisis. My fear was more, when my one-to-one sessions had finished, I was just going to be chucked back into community and would have no support from anybody. So knowing that there were those 3 sessions to have at the end, for me personally, was one of the biggest things I needed so that I didn't relapse completely. If I think back to one of the big moments that made me want to change before starting SCM, was being on a secure ward and my sister bringing something down for me and having my nephew, who at the time was probably only about 3 years old, and him seeing me through the door and wanting to have a hug. And at that point, that was one of the moments where I sort of sat down and I went, you know, if I was to end my life here, how would that affect others? I'm a lot more confident in things. Like, I never used to get on the bus to go places. I didn't use public transport at all. Being able to put myself in different situations that before would have petrified me to this day, I would have had a panic attack about the thought of leaving the house, that it just wouldn't have happened. Whereas now it's like, well, let's give it a try, and if I have a panic attack, right, we'll assess the situation there, we'll decide, do I need to go home, do I just need to have 5 minutes to sit outside and calm myself down? Which, with learning through the SCM course, helped change how I am now massively. With one of my overdoses being put in intensive care and basically saying, what you've taken, there is no antidote, we don't know if you're going to survive the night. When that moment hit me, and I thought, I've done something here as an impulsive minute that is going to change my life forever, possibly, with knowing that I could have quite easily died that night. They expected me to die, they did not expect me to still be breathing the next day. With having that, with working through the SCM things and knowing that I'm still human, but one of my main things that I wanted to do was to stop self-harming. I've been out of psychiatric care for 2 years since I've last been admitted, and since then I've managed to stop my self-harm, and I still have my bad days, but having learned new ways to cope with those things, take yourself out for a walk, do something to distract yourself, those things have actually massively helped. And I know that when I still have my down days, that those down days don't have to spiral down into the complete and utter depths. Those weeks where you don't want to go, those are the weeks that you really need to go. Those are the weeks where something's going to happen and you're going to be able to say, look, I felt like this morning. And that's when group can just be like, I felt like that as well before. It can feel like a lot of information is being thrown at you. But take time to take it home and digest it and read over it and use your one-to-ones. That's one of the main things they're there for, is to explain it to you. Knowing that I can have a bad day and come out of it without having overdosed or self-harmed or put myself in harm in any sort of way has now just made it feel so much, you just feel so much better in yourself and knowing that you are able to do this.
I've suffered from mental illness, episodes of mental illness all my life. Before I regard as the big crash in 2011, I had 5 discrete episodes of clinical depression. And in the past, one of those episodes in '86, I was a danger to myself, 2 suicide attempts. This latest episode seemed very different in the sense the period of the crisis period, the psychosis period, lasted much longer, and the impulsivity that took over led to 4 serious attempts on my life. At the time I was thinking that because the depression period felt so different, that I was incurable. When I received the diagnosis, it didn't seem like a discrete mental illness like depression or schizophrenia. So my way of thinking was, this isn't treatable. This is. I was feeling that I had something different. It was incurable, and it seemed a very personal attack. Emotionally unstable personality disorder. It seemed like an attack on myself, my very personality being disordered. I can remember going back and wrongly Googling and coming onto, it certainly wasn't an NHS site, but coming across words like incurable, drain on the resources, attention seeking. When I received the diagnosis of emotionally unstable personality disorder, the phrase borderline personality disorder only came about when I was offered the chance of the SCM. But before that, when I was trying to come to terms with the emotionally unstable personality disorder diagnosis, I've mentioned I was feeling really bad about the diagnosis. It hadn't been explained, and I perceived that there was a change in attitude from the community psychiatric nursing. But after perhaps 3-4 months after the diagnosis, the all of the psychiatric community support was withdrawn, and then I entered a period where for 16 months I was, if you like, alone with the depression and the thoughts, out of any service support. Then the opportunity came, I remember saying that there was an SEM group, which didn't mean a lot to me at the time, but it was a therapy group. I was such in a fixed negative state of mind, I didn't think it would be able to help, but what it did offer was a glimmer of hope, in the sense that I was so unresponsive that they said that I wasn't able to receive any sort of therapy, any therapeutic support. So this represented a commitment when I was told it was going to be once a week for a year, and with a one-to-one support as well. It really showed an investment in me, and I through all the negativity of my low mood, I was hopeful the first time. I thought, I'm not going to be able to manage this. It was a time where I was completely isolated. I wasn't, for anxiety, able to leave the house. So I had real doubts that I would be able to see it through or even get there, but I was grateful. I was worried for a long time I wasn't actually going to be able to get to the group, and certainly on the first time there I said very little. There was a total of 7 people in the group, and 1 or 2 were quite forthcoming, and I started thinking quite negatively, because there was somebody at the group that held a job down, there was someone who was looking after a young child, somebody else was going about what I saw as a normal week. In the early days, it was just making me feel worse, thinking that, gosh, these people are much more well than me. But as the weeks went on, 2 or 3 weeks, it was clear that we had a common thing. We had things in common. We'd all been through crises. We all had difficulties. I can remember something mundane. I shared that I wasn't able to problem solve even washing up the dishes, and a couple of people said, "Well, we did that." I can remember being in that situation. And there was always, from the outset, a lot of trust and sort of a shared confidentiality, and the sort of social side of the group was very, very important. I knew that we were going to cover three parts: managing emotions, and communication and relationships, and dealing with impulsivity, with some problem solving. But I guess, if I'm being honest, for the first 4 or 5 months, I was so unwell that the benefit was being there and coming into contact with people. I was aware of some of the things that were being talked about, but some of it was going over my head. Maybe I was starting to get a little bit better, but in the second time, when we did the second run through of the things to reinforce some of the ideas, that was where it became much more freer, and people were discussing and helping each other out, and I started to, for the first time, feel some real progress in my mood. One of the most helpful things for me with respect to the SCM may seem trivial, but it was actually having something to do in the week initially, just to simply go out and to socialise, but to meet other people, because I've been so isolated. If I'm honest, in the first sort of 5 or 6 months, I was taking information in, but I wasn't great at doing the homework, or I wasn't able to keep up with the note-taking that 1 or 2 people did. But it was mainly, that was always impressed on us, the main thing was just the commitment to try and get there and see the process through. And then I found that from a situation where my first little plan was just to try and deal with suicidal thoughts, 6 months on, I started to realise I was actually beginning to see outside of myself a little bit more, and starting to think a little bit about my family and my friends. And some of the changes were so slight, but they were there, and I couldn't quantify it, but I was getting something from the group, certainly in terms of managing my emotions, the negativity that that got so fixed into. I was being able to sort of counter it, and there was change. I was actually moving forward for the first time. So in that sense, the SCM group was so very, very important. I began to notice each month I started to plan a day ahead, and I started to started to read and take an interest in the news, and I guess it was the depression lifting, and it couldn't have been just a coincidence. I was picking up skills and getting some motivation that wouldn't have been there had I not been attending the SCM group. For me, some of the real benefits was down to the fact that it was a year-long process, and towards the end of the SCM course, the group was very much helping each other out. So somebody would present a case. So in my case, it was, can I go out and meet the kids and have a meal with them? And I was really worried and anxious about that. Everybody would help out and suggest ideas and strategies. So we were really getting benefits out of the group. And then, of course, all of the group were aware that it was coming to an end. When this was first mentioned, one of the members in the group had a bit of a meltdown and was very emotional. And in many ways, she was really just expressing what a lot of us felt. There was we didn't want it to come to an end, but we knew it couldn't go on forever. And I guess personally, it was thinking, well, gosh, am I going to relapse? Am I going to? Is the progress that has been made going to come to nothing? One of the sort of safety nets was the fact that we were told that we would still see the person one-to-one at least on 3 more occasions after, so it wasn't as abrupt as it seemed. Although, to be honest, the bonds that we'd made in the group, some of us arranged to keep in contact. In that way, it lessened the sort of stark reality that it was going to come to an end. When I reflect back to where I was mentally before the SCM to where I was after, there's no doubt it had a massive impact. I guess it was about 4 months after the SCM finished that I finally pulled clear completely from the depression. But when I contrasted, when I went into the SCM, I was totally isolated. I'd broken off all contact with my friends, my family. I was barely capable of holding a conversation. The anxiety levels were so high that I'd been in this ever deepening pit of ruminating thoughts. And SCM, just the very process of it, bit by bit, took me out of that. And when I reflect back, when the SCM course finished, I guess I'd started to message my children. They'd come across to the house. I'd gone to Kettering Mine. I was attending through the Wellingborough Mental Health team, a 5-a-side. There was a mental health walk. My week had filled up, and most importantly, I was looking outside of myself and looking forward. One of the things that was perhaps the biggest impact was getting reconnected with my children and being able to feel that love that was there. I've gone from a point where mentally I didn't want to see them, and I didn't want them to see me in the state I was. I could see a way forward now where there was still those things that I've completely forgotten, just simply being able to communicate freely and do things without thinking, which is completely taken away from you when you're mentally unwell. So there's no doubt in my mind the SCM course was absolutely vital in my recovery. I guess if I was giving any advice to people who are going to start the SCM group and to go through the process, I would say it's not easy. Persevere when things are telling you not to go to the group, or the group's not going to be of any benefit, or it's too painful to go through some of the emotional processes. To put that aside and have faith that there will be progress, that there will be a positive outcome, but to be patient. It takes time. In terms of, don't expect there to be a magic wand waved and everything's okay, but trust the group, trust the people that you're with. You may be very shy at the start, but it doesn't take long for the group to bond, and you're all in it together. So my main message, if you is a very, very worthwhile thing, and the changes come slowly, gradually, but the progress will actually be there for sure in the end.